And if you get to a point that, don't help me.
Okay.
And if you get to a point where it's like, oh, it just stops. Oh my goodness. Then what we want to do is we want to actually flex the knee and see if they can actually go further. If they can go further, that is a negative. Okay? If we go and do the straight leg raise, oh, it stops. Boom. Won't go any further. If we flex the knee and boom, it doesn't go any further, that is a positive. That means that it's not hamstring tightness that is holding them there, because with the straight leg, it's hamstring tightness that's going to prevent them from being able to go all the way. But if we eliminate that hamstring tightness and, oh, there's still something blocking the way, then that means it is testing a positive for either, a pathology in the buttock behind hip joints. It could be a bursitis, tumor, abscess, something that shouldn't be there.
So you won't be able to move it, but will the patient say like, oh, I feel pain as well, or is it just like limited motion?
Likely they will experience pain as well too, because if you're putting pressure on like bursitis, on a tumor or something like that, it's not going to feel great, right? I don't want to say 100% for certain, because I didn't see that in McGee as being necessarily a positive. Probably, but the indication of a positive is the movement of the hip with that. Question. So, this special test will be indicated if you notice in the range of motion assessment an abnormal restriction in the hip that does not follow the capsular pattern of the hip. Alright, so refamiliarize yourself with the capsular pattern of restriction for the hip. Pop quiz, what's the hip joint called?
Extension, interrogation,
It's funny, nobody actually heard what my question was. Thank you, Broxton. I asked what the name of the hip joint was, and everybody gave me the capsular pattern of restriction. Broxton heard me.
Okay.
Alright, that's correct, the acetabular-femoral joint. So get used to writing the name of the actual joint. What is your knee joint called? There is a patellofemoral joint there, but that is not the joint that we're assessing. Right? So if you put that you were assessing their patellofemoral joint, what's the range of motion of the patellofemoral joint? The tibiofemoral joint has flexion extension. No. That's your proximal tib then.
Superior, inferior, minor.
Yeah.
Yeah, because that's the only motion that the patella actually moves is the glide, inferiorly and superiorly. Right? Keep that in mind. Know the names of your joints. So positive is hip flexion does not increase when you flex the knee, and it is positive for a pathology of the buttock behind the joint. Tissue stressed is the contractile tissues of the buttocks, versa the acetabular-femoral joint, the inferior posterior chain, posterior inferior. This chain.